Hello, all of you. MBBS, nursing, physiotherapy, MLT, radiology, nursing, dentistry, pharmacist. ये आप सभी का सपना होता है। यूजली 12th के बाद आप कंफ्यूज होते हैं कौन सी फील्ड में जाना है, या ड्यूरिंग द फील्ड ऑल्सो जब आपने चूज कर लिया आपको पता नहीं होता आगे क्या है। सो आज हम डिस्कस करने वाले सैलरी, स्कोप, अपॉर्चुनिटीज, एवेन्यूज एंड सिलेबस के बारे में थोड़ी सी डिटेल। So if I talk about the very important, the first phase, चार phases होते हैं: preclinical, clinical, paraclinical and postclinical. When I talk about MBBS, so anatomy, जहाँ पे हर एक बॉडी का स्ट्रक्चर, फंक्शन, फिजियोलॉजी, चाहे वो कार्डियोवैस्कुलर हो, रेस्पिरेटरी हो, रिप्रोडक्टिव हो, डाइजेस्टिव हो, लिम्फेटिक हो, एंडोक्राइन हो, न्यूरो हो, एनी सिस्टम, इंटेग्यूमेंट्री सिस्टम हो, हर एक सिस्टम के बारे में उसकी ग्रॉस मॉर्फोलॉजी, माइक्रोस्कोपिक मॉर्फोलॉजी एंड एम्ब्रियोलॉजी, राइट फ्रॉम द नियोनेटल डेवलपमेंट के जो 3 ट्राइमेस्टर्स के फेजेस है, ऑर्गन डेवलपमेंट, हर एक चीज, रेडियोलॉजिकल एनाटॉमिकल कलेक्शंस एंड सर्जरीज, ये सारे इंपॉर्टेंट पार्ट्स होते हैं। नेक्स्ट है फिजियोलॉजी, जिसमें आपको इम्यूनोलॉजी, सेरोलॉजी, होम्योस्टेसिस थोड़ा बहुत रिलेट करके पढ़ना है। कार्डियोवैस्कुलर में एंटायर कार्डियक साइकिल, ईसीजी एंड द कंडक्टिंग सिस्टम ऑफ द हार्ट। रेस्पिरेशन में आपके मैकेनिज्म्स ऑफ इंस्पिरेशन एक्सपिरेशन। GI में मैकेनिकल एंड केमिकल डाइजेशंस। रीनल में यूरिन फॉर्मेशन एंड एसिड बेस बैलेंस। एंडोक्राइनोलॉजी में आपके सारे एंडोक्राइन ग्लैंड्स, हार्मोन, सिक्रीशंस, उनका हाइपोसिक्रीशन एंड हाइपरसिक्रीशन रिलेटेड डिसऑर्डर्स। रिप्रोडक्शन में प्रेगनेंसी, लैक्टेशन, इंटरकोर्स। न्यूरोफिजियोलॉजी में आईज, ईयर्स, नोज, टंग। सो आपको जितने भी उनके फिजियोलॉजिकल रोल्स हैं एंड फंक्शंस है वो पता होने चाहिए। बायोकेमिस्ट्री में विटामिन्स, फैटोसोल्युबल, फैट सोल्युबल मिनरल्स, माइक्रो एंड मैक्रोन्यूट्रिएंट्स, बायोमोलिक्यूल्स, डीएनए, आरएनए, प्रोटीन्स, एंजाइम्स and some diagnostic markers and clinical biochemistries like liver function, kidney function, tumor markers like P53, tumor suppressor gene, transforming growth factor। सेल इंजरी बहुत जरूरी है कि आपको सेल इंजरी के बारे में पता हो। इन्फ्लेमेशन, रिपेयर, सेल इंजरी, नियोप्लाज्म, दे आर ऑल वेरी वेरी इंपॉर्टेंट बिकॉज रिवर्सिबल एंड इरिवर्सिबल टाइप की सेल इंजरी होती है। अक्यूट एंड क्रॉनिक इन्फ्लेमेशन होता है। रिपेयरिंग के भी कुछ स्टेप्स होते हैं, राइट। जैसे ब्लड क्लॉट हो, ब्लड लॉस हुआ तो वैसो कॉन्स्ट्रिक्शन होगा, प्लेटलेट प्लग फॉर्म करेगा एंड देन फाइनली ब्लड क्लॉट होगा, राइट। सो डिफरेंट काइंड्स ऑफ कार्सिनोमा, सार्कोमा, एडेनोमा, लिम्फोमा, ल्यूकेमिया, बर्किट्स, एविंग्स, विल्म्स ट्यूमर, कापोसी सार्कोमा, हॉटकिन्स एंड नॉन हॉटकिन्स लिम्फोमा, बहुत सारे अलग अलग टाइप्स के कैंसर, basic medicine and their diagnosis. Prescription writing, yes, it is very very important when I talk about paraclinical because BID, QID, TID, 2 times a day, 3 times a day, stat, emergency, SOS, only when needed, कुछ prescription abbreviations है जो बहुत जरूरी होते हैं, that are very very vital so that you can progress well, so that you can do well, all right। So because अगर you know that person, the pharmacist, if he's not able to if there's any wrong medication error, prescription errors, there are a lot of errors which can occur. So and some are to be refilled। जैसे टीबी, मलेरिया, तो लॉन्ग टर्म के लिए जो मेडिकेशन होते हैं, सम आर नॉट टू बी रिफिल्ड। कुछ प्रेपरेशन जैसे नार्कोटिक्स, तो उनका प्रिस्क्रिप्शन लिखते हुए बहुत केयरफुल, यू हैव टू टेक लॉट ऑफ प्रिकॉशंस बिकॉज 3 ट्रिप्लिकेट्स में होती है उसकी। एक फार्मासिस्ट के पास होती है, एक पेशेंट के पास एंड एक डॉक्टर्स के पास। Then toxicology and antidotes, lot of diseases like lead, arsenic, mercury poisoning, बहुत सारे अलग अलग conditions होते हैं जहाँ पे आपको पढ़ना है toxicology के data के बारे में। How do you treat it, physical, chemical, physiological antidotes, चारकोल हो गया, EDTA हो गया, राइट, सम नैलोक्सोन फॉर मॉर्फिन, बहुत सारे एंटीडोट्स है। कीमोथेरेपी जहाँ पे आपको एंटीबायोटिक्स के बारे में पढ़ना है, एंटीवायरल, एंटीमाइक्रोबियल्स। कार्डियो ड्रग वेयर, अरिथमिया, अंजाइना, लिपिडेमिया, प्लेटलेट, कोएगुलेशन, हार्ट फेलियर। रेस्पिरेटरी में एस्थमा, सीओपीडी। CNS में अल्जाइमर्स, पार्किंसन, एपिलेप्सी, डिप्रेशन, मेनिया, एंजाइटी, सिनेप्नोटिक्स, जनरल एनेस्थेटिक्स, right, lot of bipolar, multiple sclerosis, ADHD. There are a lot of disorders। Endocrine में you have different thyroid, diabetes, GI में emetics, constipation, diarrhea, all right। They are some of the cough, some of the very very important ANS में sympathomimetics, parasympathomimetics, basic receptors, PKPDs। Microbiology में bacteriology fight because there are different markers, one is radiological, X-ray, CT scan, PET CT, MRI, 3D echo, other is some device like pulsimeter, oximeter, spirometry, glucometer, right? The next is a clinical biomarkers like P53, tumor suppressor gene, SGPT, SGOT for liver, For lungs, FEV1 and volumes, respiratory volumes. For heart, LDH-C can be troponin. For kidney, we have creatinine, BUN, GFR. All right. Hematology में RBC, WBC, platelets, and other markers also we have in blood tests like hemoglobin, hematocrit ratio, MCV, mean corpuscular volume, packed cell volume, PCV. A lot of different important terminologies that you should know. So those are all biomarkers. Then you have tissue markers, histopathological markers like gram staining, GEMSA, acid fast, HNE, PSR, टॉल्यूडीन ब्लू, बहुत सारे टाइप के स्टेनिंग होते हैं. तो अलग अलग डिजीज को अलग अलग तरीकों से हम आइडेंटिफाई कर सकते हैं, उनके प्रोग्रेशन को, उनके स्टेजेस को. ऑलराइट. So you must know about the basic clinical then we have forensic medicine. So forensic nursing, forensic physiotherapy, forensic pharmacy, forensic nursing. ये बहुत सारे important है because in case of rape cases or some crime incident, legal cases, autopsy reports को पढ़ना आना चाहिए, biopsies, offenses like poisoning, trauma, and disease condition like PTSDs. So medical ethics and laws must be known to you. Community medicine, where you learn about pharmacoepidemiology, what is sporadic, epidemic, endemic, pandemic, basic biostatistics, preventive medications for infectious diseases. Like we have a lot of neglected tropical diseases and infectious diseases that are, prevailing. Some national health programs and screening programs like National Vector-Borne Disease Control Program, National Malarial Control Program, National Tuberculosis Control Program, etc. Ophthalmology में completely about the eyes, retinal disorders, glaucoma, cataract, and retinopathy, surgeries, and all refractive errors, myopia, diplopia, presbyopia, astigmatism. So complete things. Similarly for ears, otitis media, or ear, nose, throat, you have sinusitis, rhinitis, vertigo, laryngeal, tonsillitis. So there are different expertise field: gynecology, pediatrics, obstetrics, general medicine, general surgery, that you need to learn palliative care and special care or bedridden patients, cardio, respiratory, musculoskeletal, neuro, है ना, endo, osteo, skeletal-muscular, arthro, joints, so bone, skin, liver, lung, kidney, intestine, heart, brain, spinal cord. There are expertise at sensory organs. So there is a basic specific, and when you go for your post graduation, you study all of this in detail, the complete dissection or the complete root from the root. And the general surgery, suturing, basic suture, what is sutures, fluids, shock. There are different shocks: cardiogenic shock, where we give dopamine; anaphylactic shock, where we give epinephrine; septic shock, where we give non-epinephrine; hemorrhagic shock, ischemic stroke. बहुत सारे types के strokes होते हैं and shocks होते हैं. So you must know about the different types of catheters, ligatures, like how to insert a cannula. Also catheterization में you must know about basic Foley's catheter, Riles tube, intubation, tracheostomy, different terminologies of removal of organs, and like vasectomy, tubectomy, orchiectomy, hysterectomy, oophorectomy. Lot of conditions that you must be aware about. Gallstone removal, different organs and their diseases, right? You should be knowing about it. And obstetrics में prenatal, antenatal, perinatal, postnatal care. What are the complications, oxytocic, tocolytic agents in pregnancy? What is IVF, in vitro fertilization, and surrogacy, and post pregnancy parturition, and the processes of breastfeeding, lactation must be known to you. Pediatrics, nutrition, neonatology, infectious disease, congenital diseases, lot of drugs like carbamazepine, spina bifida. There is a complete chart of which drugs are indicated or to be given in pregnancy and which drugs are contraindicated or not to be given in pregnancy. So you must be thorough with that. Orthopedics may you study about the bone arthritis and different conditions, gouty, rheumatoid, where there is pain, inflammation of the joints, spinal muscular atrophy. Now Zolensma, that's a very famous gene therapy developed. Phase 3 में dermatology, venerology, venereal disease, sexually transmitted disease basically. So you have syphilis, trichomoniasis, chlamydia, gonorrhea, HIV, eczema. There are different conditions like pustules, eczema, fissures, fistula, right? Rash. So these are commonly interchangeably used, but they are not the same. They are having different markers. They are having like you have apoptosis, necrosis markers, which are cell death markers. We have cell differentiation and proliferation markers. So you must be aware about it and different techniques to measure them. Right? We have flow cytometry and all. Psychiatry, maybe have depression, anxiety, schizophrenia, substance abuse, specifically, rehabilitation, psychotherapy is very, very important with child psychiatry, because in such patients, they are vulnerable. They may harm themselves, and, they might show some withdrawal symptoms. So special care, then certain devices, then certain diagnostic reports and their identification, like suppose if an ECG, so interpretation, X-rays, interpretations, anesthesiologist, so pre-operative, post-operative, because anesthesia is an art. So there's a CCB, critical care basis. If there's less anesthesia, the patient may wake up during the surgery. If there is, more anesthesia, the patient may go in coma, paralysis. Emergency medicines, where you learn about the CPR, cardiopulmonary resuscitation, disaster medicines, acute management of these emergencies, etc. Now let's study something about the dentistry. So dentistry is an also very important field where you can go into cosmetics, surgical, as well as non-surgical or consulting dentistry. So there are different implants, dentures, aligners, braces, and different teeth related um devices or teeth related operations that are being carried on. So teeth whitening, desensitizers, anti-caries agent, anti-plaque, and calculus. Lot of terminologies related to your teeth. All right, for maintaining oral hygiene. So we have oral candidiasis, lot of oral infections that you must be aware of. So trigeminal, facial, glossopharyngeal nerves, basic teeth structure, crown, dentine, pulp, cementum, what are the different processes of the mouth, and what are the components. Like if we talk about toothpaste or dentifrices, tooth powders, you must know that it should contain fluoride in a particular ppm concentration, beyond which it can harm. All right, muscle physiology, blood groups and coagulation. Then you must know about the dental anatomy and histology, where you have to tooth morphology, complete dentine sensitivity, what is a carie, how does a carie occur, the pathological microorganisms like the staphylococcus mutans, necrosis and apoptosis, repair. So our body is such a great system. It can repair, heal, right? So DNA repairs, kit types, pharmacology, therapeutics may complete information about all the oral drugs like amoxicillin and all, as antibiotics, antifungal may, or nystatin and all, analgesics, local anesthetics while tooth extraction, wisdom tooth. So you should know about incisors, canines, premolars, molars. What are these stuff? So 8, 8, 8, 8. Together they form 32. That is why the teeth is diploid type, milk teeth and permanent teeth. And teeth are important also because there are four types of teeth. Heterodont, so that must also be known to you. General medicine and surgeries. So we will learn about pericarditis, endocarditis, HIV, hepatitis, shock, trauma. The next is oral pathology and microbiology, where you learn about the plaque, calculus, biofilm formation. And your oral health is very important because there are a lot of microorganisms that are there, and a lot of processes like mastication, salivary amylase, salivary glands that are being located. So excessive sugar, if it is developed, then it forms caries, calculus, tartar. And you must know the composition, like the hydroxyapatite of the part of the enamel, which is one of the strongest part of the body. Then you must know about the zinc amalgam cement that is added in the materials, right? You are expected to know about that. Then cone beam computed tomography, CBCT, radiography, carrier analysis, oral lesions, right? There are a lot of lesions, oral cancer, carcinoma. Then PDL anatomy, gingivitis, periodontitis. So PDL is periodontology, right? Plaque, bone graft, so graft try muscular cysts, tumors, fractures of the maxilla and mandibular, trochlear junctions. These are all very, very maxillofacial surgeries. Then there are certain materials like the amalgams, composites, root canal therapy, RCTs, obturation techniques. Prosthodontics may you study about the osseointegration, where there's dental implants. Orthodontics may Angel's classification of malocclusion, right? Periodontics may of the child, pulp therapy, avulse teeth management, fluoride therapy, etc. Public health dentistry, where public health dentistry is very important. So there are a lot of initiatives by the government of India, also dental programs, water fluoridation to reduce the bioburden of dental diseases. So basically, you are supposed to read about the biomaterials, In the forensic odontology, bite mark analysis. This is also one of the important analysis that you perform for forensics odontology. Implantology, where you learn about surgical and prosthetic phases, endoosseous, periosteals. Oral pathology like odontomas, cancer, salivary gland tumors, cemento-osseous dysplasia, anaplasia, metaplasia, dysplasia, atrophy, hypertrophy is all cells. Cell converting from one cell to another, cell count reducing, cell number increasing, cell number decreasing, cell size decreasing, lot of different terminologies that are related. Xerostomia, which is dry mouth. So nowadays for dry mouth, also a lot of cholinergic system is underactivated. So we give overactivation or hyperactivate that. Similarly, hiccups. So for hiccups, we stimulate the vagus nerve because hiccups may one of the most common treatment choices. Either you breathe, hold your breath for some time, or you just stimulate your vagus nerve. Then the next up that we have is physiotherapy. So physiotherapy subjects and key concepts. Let's start. Physiotherapies of different types like the pediatrics, geriatrics, orthopedics, neurologics. So anatomy, structure of the function of the muscles, bones, skeletal-muscular system, reflexes, sensory nerves, motor nerves. So you study about the psychology, sociology, physiology, biomechanics, biostrongs, right? Exercise therapies like the gait balance, posture balance, ultrasound, laser therapies, and you should also be as a you should also have a thorough knowledge of the pathology like the sterilization, repair, inflammation. Some general medicine diseases like hypertension, myocardial infarction, COPD, diabetes, wound healing, burns, fracture, arthritis, spine disorders, stroke. Then we have Parkinson's, multiple sclerosis, where we have fingolimod, non-communicable diseases, and community burden rate, bioburden rate, where you check different markers, morbidity, mortality, via social stratification, mobilization, different movements like flexion, adduction, abduction, right? There are different movements, and our body has different planes: superior, inferior, anterior, posterior, and different terminologies like the planes, sagittal plane, transverse plane. All right. So physiotherapy is a very, very important subject because you also learn about the cardiorespiratory, like the breathing exercises, cardiac rehab, milestones, like the congenital anomalies, like Epstein's anomaly and all, prenatal, antenatal, postnatal care. And physiotherapy is also an important role in athletes, like sprain, strain, ligament tear, muscle tear, fractures. So RTP protocols, return to play protocols, you must be knowing, and an evidence-based approach is usually adopted. So you can also perform your post-graduation in the cardiorespiratory, skeletal-muscular, neuro, orthopedic, pediatric, women's health, or sports. The next step that we have is nursing. So nursing is of different types. Nurse consultant, as in the first page you would have seen, there are different types of nurses: pediatric nurses, geriatric nurses, and the nurses for palliative special care patients, neuro, cardio, operation theater, ICU nurses. Right. So nurses usually have to study in detail about the different surgical procedures, like what is a decatheterization also is important, catheter insertion, cannula insertion, blood withdrawal, or ascitic fluid withdrawal within that using a 10 ml syringe, the different administration of injectables like intramuscular, intradermal, subcutaneous, intravenous, the different routes, how to inject, how to aseptic alcohol swabs, say what is the use, complete details must be known, and all the urological instruments, histopathological, nursing care, because a nurse has to be empathetic. So empathy and nursing care or patient counseling, that's what medication adherence remains, medication safety, medication ethics lies. All right, so cell transport, cell to cell communication, normal body functioning, physiology, many things are repeated that I already mentioned. That is the reason that I'm skipping it because healthcare profession or medical profession is like an interdisciplinary. Most like pharmacy, nursing, dentistry, physiotherapy, MBBS, they all learn about the diseases. They all learn about the pathophysiology, human anatomy, and physiology. They all learn about medicines. Some learn about movement, some learn about in detail about the surgery, some learn about the insertion of the surgical, some learn about the medication like pharmacokinetics and dynamics. So expertise lies everywhere, but they are all interdisciplinary fields. Some things one professional might know, the other might not know, right? All the clinical biochemistry tests like kidney function, liver function, heart, liver, cardio function test, thyroid function test, T3, T4, and all. Then you have the bone scan, which is the DEXA scan. So there are different scanning techniques, procedure, also mammography, biopsy, different scanning methodologies for breast cancer and all that are now being, continuously adopted for these are all radiological procedures. Nutrition and dietetics may balanced diet like carbs, protein, lipids, diet to be adopted while pregnancy, lactation, or special therapeutic diets. You would have heard about vegan diet, keto diet, and a lot of diets, Mediterranean diet. So in comorbid condition like diabetes and hypertension, what kind of diets can be adopted? Nursing care, basic nursing of how to make the bed of the patient to the checking the vital signs, because if the patient is on the ICU or if the patient is on the ventilator. So basic like how to give infusions, what is the process of centrifugation, dialysis, hemodialysis, urine dialysis, plasmapheresis. All these procedures must be thoroughly known to the nursing field. Psychology में human behavior, mental processes, learning, memory, coping, anti-doping and all. Because personality intelligence is very, very important. If the patient is psychologically, or there's a term called placebo effect. If the patient is psychologically not fit, the patient might land up into trouble. So you have to study about the microbiology, bacteriology, virology, phycology, mycology, how is hospital acquired, basics of computer, because data entry is also important, right? Nursing care, pre-operative, peri-operative, post-operative, intraoperative care, because there could be transplants, implants, or surgeries, grafts. There could be different drugs like immunosuppressants and all, which could be given. So taking care of the patient's need, patient's movements, monitoring patient's vitals is some of the important duties of the nursing field, right? Safe medications, what medication are to be given empty stomach or on food, with milk, without milk, with food, without food, right? Or to be given at night or day, that is called chronotherapeutics or chronobiology, where chronesthesia and chronergetics, chronopharmacology lies. You're right, basics of human genetics and inheritance, because there are a lot of autosomal linked, X-linked disorders, a lot of sex-linked disorders that are, prevailing. So basics of human genetics, primary health care and the health education, PHCs. There are a lot of centers like Anganwadi, ASHA workers and all, a lot of programs that are being carried out for special care and, to prevent like immunization programs. So a nurse should also be aware about the immunization schedules, right from Japanese encephalitis to influenza to the different vaccines like the polio, which are very, very important, measles, mumps, typhoid, tuberculosis, polio, all the immunization schedules you must know, audiovisual aids. This must be thoroughly, thoroughly known to you. Medical, surgicals, neurology, nephrology, oncology, or endocrinology, use of advanced equipments, right? If the baby, if there's a premature baby or the baby is post-mature, after 9 months also it has come. So special care is to be taken. So nursing is like, there is healthcare profession in every field, right? From your bank, there is in SBI, in RBI, there's a bank, in the insurance companies, in the sports, in the ministry, in the airways and defense. There is role of Sepoy, ISRO, lot of different big organizations, Tata Memorial, different organizations have help, opportunities for the healthcare professionals, right from your defense to your banking to your insurances to your athletes, sports, everywhere they need a pharmacist, military, Indian Navy, armed forces. So even if you have wanted to be a Navy officer, you can be through a doctor, you can be through a pharmacist, you can be through a nurse, you can be through a physiotherapist. All right, there's always a scope of achieving your dreams even after you land up in the field that you didn't want to. अब आप आ चुके हैं तो उसका best use करो, right? उसका आपको अपना best देना है. So that is important, like health promotion, disease prevention, taking basic care, ward supervising. These are very, very important processes. Taking small, small notes, the patient details. The next up, we have radiology. So here you just basically have to study. There's not much detailed syllabus. You just have to study about the anatomy, physiology of different organs, blood collection techniques, blood withdrawal, biochemistries, microbiology, pathology, pathophysiology, urine analysis, CSF fluid collection, pleural fluid analysis like lung fluids. All right, many times we have sputum that is being taken. So clinical biochemistry may all the tests that I've already mentioned to you are being covered. Blood banking, cross matching, because many times ABO, blood grouping, phenotyping, and all, blood coagulation like APTT, PTT, plasma thromboplastin, blood clotting time test, biohazard management, pap smear preparation, waste management, because there are a lot of waste that needs to be segregated. So that is also very, very important part. Then physiological functions, pathology, microbiology. These are all important functions that you must know. ALARA hazards, accessible and all. USG, ultrasonography, CT scan, computed tomography, magnetic resonance imaging, PET CT, positron emission tomography, computed tomography scans, dosimeters and all that are important. And then these are all fluorescence or cell sorting fast. It's like an emergency where there's stroke, so speech, face, arms, and all is being observed. Angiography, bypass surgeries in the cardiac. There are a lot of stents, bulbs, addition. So you should be aware about all of this. So that's it for today's important video on the pharmaceutical, nursing, MBBS practitioners, healthcare professional medicos, MLT radiology, medical lab technician, physiotherapist, dentistry. I hope that it was insightful for you to learn about different healthcare professions. Wishing you all good luck for your life ahead.